Awesome. Thank you for the kind introduction. Before I start tonight's talk, I'll give it a little bit of a background about myself. So I'm Miles Tomarosson. I'm one of the colorectal surgeons with Paragon Surgical Specialists. I'm originally from the great state of Nebraska, and that's where I attended my medical school. I then did my general surgery residency in Des Moines, Iowa, and eventually went on to do my colorectal surgery fellowship at the University of South Carolina, Greenville. And I've been working with Paragon Surgical Specialists since the latter half of 2024. So before I start my talk tonight, what I'll say is that an increasingly larger part of my practice has included patients with fecal incontinence, which is exactly why we're here today. So I would like to say thank you for joining me tonight, and hopefully tonight's discussion will give you a little bit more insight about this particular issue, and then also what we at Paragon Surgery can offer for you. So many of you have probably had the thoughts that are listed on this slide. You might be feeling concerned, exhausted, overwhelmed, but also maybe a little too embarrassed to talk about it. Studies have shown that as many as 54% of people who have bowel control problems have not discussed it with a doctor. So too frequently, people aren't getting the help that they need, which is exactly why we're here. So today we'll discuss fecal incontinence and then also provide you with some information about a therapy that has helped many people with this particular issue. It's really important to note that incontinence is not a normal part of aging, and it's not something that you should just have to live with. It's a legitimate and serious health issue. The descriptions that you see on the slide may sound very familiar to many of you if you've been having this issue. The bottom line is that whether you call it bowel incontinence, fecal incontinence, or FI, which is an abbreviation, it's an embarrassing condition and it can have a significant impact on your quality of life. It may even prevent you from going to places or doing things that you like. It might make you fearful of an accident. It may leave you always looking for the next restroom, and it may require that you make frequent trips to the restroom throughout the day. If that's the case, your body's trying to tell you something, and I would encourage you to listen to your body. One thing that you should know about fecal incontinence, you're not alone. Fecal incontinence, which is commonly abbreviated as FI, is very common. It's estimated that 1 in 12 adults in the United States suffer from bowel control issues. To kind of put that into context, that means that FI is just as prevalent as other conditions like Alzheimer's and asthma. And those are two conditions that are very frequently and commonly talked about. So you might be asking yourself then, well, if it's so common, why aren't we talking about it? I think there's multiple reasons for that. As we discussed earlier, many people are pretty reluctant and for good reason to discuss this issue with others because it might be a little too embarrassing. Because of this, many people with chronic fecal incontinence self-manage their issues. They do this by changing their diet. They might wear pads, and then they start restricting their social activities. Now, at the same time, many healthcare providers don't realize just how embarrassing this issue is and how embarrassing it is to talk about your bowel control issues. So basically, what happens is we don't ask, you never bring it up, and then it just stays hidden and never gets addressed. It's worth mentioning that bowel control issues can happen to women and men of any age, and although your risk increases as you get older, that doesn't make it a normal part of aging. It's not something you should accept, ignore, and definitely not something that should be left untreated. If you ignore this problem, it can actually cause serious issues, including issues like depression and then a decrease in your overall quality of life. So before we dive into how fecal incontinence is treated, it's important to understand the communication that occurs between your brain and your bowels and how critical it is to this whole process. So bowel function involves the coordination of the brain and muscles through nerve signals. Those nerves cause muscular contractions, which then squeeze the food through different sections of your intestine. And each section is separated by different bands of muscles or sphincters that kind of act like valves. The digestive system then works by moving the food through the intestines all the way down to the rectum, which usually takes about 24 to 72 hours. And as the rectum fills with waste, your nerves in the rectum tell the brain that it needs to be emptied. So then your brain tells the sphincter muscles in your anus to relax so that defecation can happen. Now, multiple studies have been performed that have suggested that bowel control problems are linked to poor communication between the bowel and the brain. And this indicates that this is a really key and critical component of the disease process. Now, this is a very general overview, but I just want you to keep these points in mind for later when we talk about the different treatment options for FI. The good news about fecal incontinence, it's very treatable. Now, there's numerous steps that are involved in finding the best treatment for you in particular. And this even sometimes requires multiple visits and multiple discussions, and quite frankly, extensive discussions with your physician. There's a wide variety of treatment options, and they can range from both conservative treatments and as well as more advanced therapies, which I'll outline in just a moment here. One thing worth mentioning before we discuss the different treatment options is that each person is unique. That means that what works for someone else may not necessarily be the right treatment option for you. So let's start with conservative treatments. The first thing to try to help with your fecal incontinence symptoms are often pretty simple lifestyle changes. So in other words, there's just behavioral changes that you can make to try and help your situation. It might mean that you change what you eat, you adjust your fiber intake, or you might eliminate some certain troublesome foods that might cause you to have loose stools and diarrhea. It might also include physical therapy, particularly pelvic floor physical therapy, which focuses on exercise that strengthen the sphincter muscles of your anus and then your pelvic floor muscles. It might include bowel retraining. This includes things like delaying going to the bathroom or using a strict schedule for your bowel movements. There's also medications that we can use to help with this. I would say a common class of medications that we use are antidiarrheals, and they may help some people more than others. And these are simple over-the-counter medications that we pretty frequently use. So you might be thinking to yourself, like, there's no way that these small little things can help with such a big, significant, and burdensome problem. And what I will say before we move on and talk about other treatment options is that I have had plenty and numerous patients respond very well to these simple measures, which is great because those patients then avoid more invasive treatment options. I will say, however, that in some cases, these lifestyle changes may not be enough and may not work very well. It's hard to tell when we see people for the first time in the clinic. If that's the case, then there's more advanced therapies that can be offered, which we'll outline here next. So there's multiple advanced therapies that can be considered, but I'm going to take just a moment to highlight one particular option in particular, and we'll go into more detail about this later. And this includes sacral nerve stimulation. It's also called Interstim. Interstim is a therapy that's been around since for fecal incontinence since 2011 and has shown to be superior to oral medications and has been used pretty frequently. Over 400,000 patients worldwide have been given this device to help with their bowel control issues. Now, I'll dive into the details about the Interstim therapy in a little bit, but first, before we do that, I'm just going to briefly review some other surgical and advanced options that could be available for you if the conservative measures don't work. So some of the other surgical options that are available outside of the Interstim therapy are sphincteroplasty. This is the same thing as this anal sphincter repair. This corrects the incontinence issue by reapproximating the sphincter muscles to recreate like a muscular ring around the anus. Another surgical option for FI includes creating a colostomy, and this does involve making a stoma, which is a surgically created opening in the abdominal wall through which the colon passes through, and the colon empties stool into a disposable bag. Now, there may be some discomfort with these options, and certainly living with a colostomy does require some adjustments, and these are lifestyle adjustments. But in these situations, when we use them, the long-term benefits outweigh these particular issues. So let's talk about the Interstim system a little bit more. So the Medtronic Sacral Neuromodulation, or SNM, uses the Interstim systems. This therapy gets the SNM because it provides relief and restores bowel function and bladder control by gently stimulating the sacral nerves, which are the nerves in your pelvis. So I'm going to give a real life scenario to outline just how the Interstim device works. Say you're having a dinner in a loud restaurant and you're having a difficult time hearing your partner, whoever you're having dinner with. And that may be because the background noise is interfering with your ability to communicate. If you remove the background noise, you're more likely to hear the partner just fine. So this therapy, the Interstim therapy, works by delivering small electrical impulses that block out those inappropriate nerve signals. So in this case, that would be the background noise. Getting rid of the background noise then lets your bowels and bladder talk to your brain without that interference, and it helps restore that normal communication that's needed to help control your bowels. I will say when this device is implanted, it's located just above your buttock. I would say the side or whether it's the left or the right buttock is patient dependent. And the model of device that I use for this particular issue does not require any recharging. So, what makes someone a candidate for Interstim therapy? Typically, patients are considered for Interstim therapy if you have significant fecal incontinence symptoms, and then you've not gotten any relief from these symptoms despite trying many different kinds of medications and lifestyle changes that I outlined before. So, if this sounds like your experience, the first step is typically an evaluation. So, let's talk about that a little bit more. This evaluation involves placing thin wires in the upper part of your buttock, which are then attached to a small external device that then delivers the Interstim therapy. So, this particular procedure or evaluation can be performed in the clinic. It's very well tolerated by patients. It involves injecting some local anesthetic to help with any discomfort that could potentially occur. If it's difficult to tolerate in the clinic, it can be performed on an outpatient basis in a surgery center. After that procedure is done, you then track your fecal incontinence symptoms over the course of a week, and then the results are reviewed. If you demonstrate a significant improvement in your fecal incontinence symptoms over that time, you're then considered for implantation of the Interstim device. There's a couple things that I wanted to mention and a couple nice features about the Interstim device. The first is Medtronic's My Journey app, which is specifically designed for patients undergoing Interstim therapy. This app has a lot of different features, but most notably allows you to track your symptoms and offers resourceful educational materials. If you're interested in downloading the app, please feel free to scan this QR code or go to the website listed. And if you don't have enough time to do that right now, I know that we're going to list this or make this available at a later date. I'll just touch base on one additional feature that's nice. This is a fairly busy slide, but another nice feature about the Interstim device is its SureScan MRI technology. This is a particular technology that enables patients to get full body MRI scans and is the only sacral neuromodulation system with this particular technology. So the Interstim system has proven results and has been an effective treatment option for fecal incontinence since 2011, with one study demonstrating almost 90% of patients using Medtronic's Interstim therapy experiencing long-term success. So why does that matter? Because it shows that this therapy can really improve your quality of life and that these results are durable. So I think this slide highlights the impact that the Interstim device can have for patients with fecal incontinence. Admittedly, I'll say Alan is not one of my personal patients. However, what I will say is that my Interstim patients are some of the happiest people that I see in clinic and have given me similar testimonies to what Alan says here. So that's the discussion. What happens next? Just contact my office to schedule an appointment. And after you make the appointment, we can talk one-on-one. Now, I'll take the time to answer any questions that you may have.
This has been so great. Thank you so much, Dr. Thomarazan. I do have a couple questions that have come through. And the first one is, do you know if it's possible for patients to speak to someone that might have had this device or have gone through some of these different things?
So what I will say is we at Paragon do have some people that would be willing to discuss this particular issue with you. And I know that Medtronic is a very reliable resource as well for this sort of thing. So to kind of go back to your question, yes, there's definitely resources available for you to talk to others about it.
Awesome. And then can you maybe describe like what is considered a leak? That was one of the questions.
Yeah,